Great. So it's 3 minutes after, so we should get started now that we have everyone on the program here. Hello, everyone. Welcome. My name is Susan Naranjo. I'm the Public Affairs Director with CIR. We have a short program for you today. You'll be hearing from our Councilmember Lander and Councilmember Rosenthal. You'll also be hearing from our Secretary Treasurer and members from the two major hospitals where we're currently at negotiations. There will be time for questions right after. And I'll go ahead and pass it over to our Secretary Treasurer, Linda Alvarez.
Thank you, Susan. Good afternoon, everybody. I am Dr. Linda Alvarez, National Secretary Treasurer for the Committee of Interns and Residents, or CIR. Founded in 1957, CIR is the National House Staff Union representing over 17,000 interns, residents, and fellows in hospitals across the country. To give some context as to why we're here today, residents at New York Presbyterian, Brooklyn Methodist, and Mount Sinai, Morningside, and West have called this press conference to describe what they are seeing as doctors on the front lines of the coronavirus, to share their frustrations trying to have their voices heard by the administration, and to discuss their ongoing contract negotiations and why residents in these big hospital systems need the security of a settled contract now more than ever. First, we are going to hear from City Council Member Brad Lander, who represents District 39, which includes New York Presbyterian, Brooklyn Methodist Hospital. Councilmember Lander, thank you so much for joining us today. I want to be able to pass it over.
Thank you guys for everything you're doing. I mean, it's such an honor to be virtually standing with you at this time. I mean, yesterday, I'll be honest, was the first time National Doctors Day came around, and I noticed that we had it, you know, like that's a day that I don't think we always pay enough attention to. And obviously, what our interns and residents and doctors and all healthcare workers are doing right now is just unimaginable. You know, we're out here sheltering in our homes, trying to slow the spread and save lives. You guys are in the hospitals, in the healthcare institutions, as they are facing the greatest crisis we've ever seen. And the support that we all feel for healthcare workers right now is just really like nothing I've ever seen before. But I think, unfortunately, as what we're seeing in this crisis in so many other ways is problems we already had and weren't paying enough attention to are having the light shined on them because they're both exposed and exacerbated by the COVID crisis. And that's true in a ton of places. That's true on Rikers Island. It's true in our emergency food delivery system. It's true in all the ways, all the kinds of inequalities that are showing up. But boy, one way that people need to hear more loudly is that the residents who we already have had working 80-hour weeks and not providing the protections of a good, solid, settled contract, even with some of our strongest, wonderful healthcare institutions already facing those challenges, now are facing them in just unimaginable ways. And so the fact that residents at New York Presbyterian Brooklyn Methodist Hospital, which is in my district where I've been many times, where I've been a patient, where my kids have been a patient, that the residents there have been working for a long time before this crisis to settle just a good, decent contract. You know, these are residents who are going to work extremely hard. There's no one looking for a 40-hour work week here. These are folks who are working way and above and beyond the call and know in a contract they're still going to be working above and beyond the call in this crisis and long beyond this crisis. But boy, I support their efforts for pay parity with other residents in the New York Presbyterian system. We were glad when Methodist Hospital became part of the NYP system because it offers resources and connections to all kinds of things, but that's got to include making sure that the residents have pay parity at Methodist with everybody else, with all the other residents in the NYP system. So even in this crisis, when we're doing all we can to support our healthcare institutions, we have to do all we can to support, first and foremost, our healthcare workers. It's my honor. I'm just in awe of what you guys are doing right now. So deeply grateful. And of course, we stand with you every step of the way in calling on NYP to settle the contract with you, to give those workers pay parity, and to give you the contract, the pay, the benefits, and above all, just the respect and dignity that you so deeply deserve. Thank you very much.
Thank you, Councilmember Lander. We appreciate you being on this call and supporting our residents. Next, we are going to hear from City Council member Helen Rosenthal, who represents District 6, including Mount Sinai West, and supported our CIR members at a contract rally on March 10th, as the COVID-19 epidemic was just beginning. Thank you, Councilmember Rosenthal, for your support and joining us today.
Absolutely. Can everyone hear me? Ooh, just checking. Is my...
Yes.
Oh, okay. Just
You're all good.
Still on mute. Well, of course, I want to thank you for all the work that you're doing every day and echo my colleague Brad Lander's comments. You know, it's a medical emergency, so we need all medical hands on deck. And obviously the residents are on the front lines. And all the workers, especially those on the front lines, you have to be able to focus on taking care of your patients, which is what you're trained to do. COVID-19 patients are often in great pain, and because there is no cure, they are terrified, not knowing whether or not they're going to live. And on top of all that, they are highly contagious. These are the patients that the Mount Sinai medical residents that I spoke with, and I know you all are, you are treating these patients for 80 to 120 hours every week. So how can Mount Sinai expect their residents to do this work when the medical institution they work for is not taking care of them? How can the residents treat highly contagious patients when they know they're at greater risk than necessary of catching and spreading the disease themselves because management is not taking all recommended safety precautions and this contract dialogue has broken down? How can residents work long, demanding hours and treat highly contagious patients when the cafeteria now has limited hours and the hospital is only offering snacks, not meals? And so the residents are forced to go outside of the building at the risk of spreading the contagion to get needed food. How can the residents treat highly contagious patients when they are told that the rent for their hospital provided housing is going up, but salaries are not going to increase to cover the costs? Medical residents should not have to fight with the hospital administrators over basic working conditions and critical safety measures during this profound crisis. And nor should the residents have in the back of their minds the issues of sexual harassment, lack of providing lactation rooms, not having pay parity, etc. Mount Sinai has to come to the table and work in good faith with you all. And that's for all of our safety. It's why I really appreciate all of the amazing work you all are doing every single day. And it's been an honor to be able to help with the meals for the residents. And we're looking into expanding that for other of your hospitals as well.
Thank you, Councilmember Rosenthal. We appreciate all of your support and your words of encouragement for residents. We are now going to hear from some of the residents who are on this frontline crisis. First, we have Dr. Jayakumar from New York Presbyterian Brooklyn Methodist Hospital. Doctor.
Thank you, Linda, and thank you everyone for being here, especially Council Members Lander and Rosenthal. We're so grateful for your support and for any support that we're getting for the community right now. I just want to touch on some of what we're experiencing as residents right now, as well as the issues with some of the relaxing government regulations in the hospitals and my own personal experience being quarantined. I also want to clarify that I'm not a representative of the hospital. I'm just here talking from my perspective as a resident physician and as a union member. I know the national PPE shortage has been a big issue in the media, but there's other things that I personally feel like the public should know from the perspective of a frontline doctor and as a resident especially. One of the most difficult things that we've had to deal with about working in the hospital right now is the flow of information from the administration to the residents. And I know all of us, the residents including, are so appreciative of how hard administration is working to confront this crisis as it unfolds. But at the same time, we're definitely feeling the impacts when we don't receive that clear communication. One example that I had was last weekend, we had been called for rapid responses, and all that shows up on our pager is that it's from the pediatrics unit. And I know that some of my colleagues actually went there and they responded. And after arriving there, then they found out that the pediatrics unit at our hospital had actually been converted to a COVID unit. So, you know, they weren't adequately prepared for that situation. And this is information that I think could have been handled in a better way rather than just having to find out when you're actually in a crisis situation. Another thing that I want to address is actually the psychological toll that we as residents and frontline healthcare workers are experiencing. I know that most of us as residents, we're young in general, 20s, 30s, but I've had other colleagues come to me and we're all kind of having to confront our own mortality and health for the first time. Some of my colleagues came to me with concerns about their families, their homes, and even what would happen if they actually die as a result of this. So it's pretty scary stuff that's happening right now. You know that when people think of doctors, they usually think of people who are older, highly paid. But as residents, we have these jobs where in general, we're really working hard, we're not paid enough, we're overworking, and now we're compounding that with an emergency situation where we feel like we owe it to our patients to do everything that we can. And for me, that's a recipe for disaster. We're gonna do everything that we can for our patients, but it's extra difficult to come into work every day not knowing what's gonna happen, not having any say in what is going to happen to us. And I think that that's a big fear for all of us right now. I also want to touch on the issue of regulations for healthcare workers. With every revision of government regulations for the healthcare workers that's happening, it seems the priority is shifting more and more away from preventing the spread and towards keeping healthcare workers in the hospital at all costs. I know that a week or two ago, we were supposed to self-quarantine if we had high-risk exposure to any COVID patient, but now that it's become so widespread, we're just supposed to self-monitor and keep coming to work. The latest science is clear that this is spread largely through young asymptomatic carriers, and by and large, residents do fit that demographic. So we're likely carrying COVID, and because these policies keep relaxing, we're spreading it to our coworkers and to our patients. I myself am actually homesick right now, and I was placed on quarantine after showing some of the symptoms of COVID. And I know that so many other residents at my hospital are in the same situation right now. As a doctor, and especially as residents, I know that we're all used to working straight through our illnesses. We're used to feeling that pressure to work even when we're sick because of the high pressure environment of our training programs. But in this scenario, I think that's something that we all understand it's not about the resident personally, it's not about me personally, it's more about the community and protecting the other people who could be affected by me coming into work knowing that I am symptomatic. Thank you.
Thank you, Dr. Jayakumar. Next, we will hear from Dr. Doherty, also from Methodist.
Good afternoon. I'm Dr. Brian Doherty. I'm a fellow at Methodist, and similar to Dr. Jayakumar, I'm not a representative of the hospital. I'm just here in my capacity as a physician and as a member of the CIR bargaining committee. Thank you everyone for being here. I'd also like to thank Councilman Lander and Rosenthal for standing with us. Recently we've given the hospital our ideas of how we can reduce the spread of COVID amongst hospital staff, and unfortunately they've largely been unresponsive. For example, at our hospital, all residents are required to clock in every day in order to get paid, even days that we aren't working, even though we are also salaried workers. We've asked the hospital to eliminate this policy to try to decrease the amount of exposure that we get on public transit, going into the hospital, and potentially spreading the virus when we don't need to be. We've also asked that N95 masks be provided to pregnant or immunocompromised residents to make sure that we keep those people safe. In addition, we've also asked the hospital to have to clean our scrubs so we don't bring these contaminated clothes home. And while most of us are younger, Unfortunately, we cannot choose how sick we get, how sick our family members can potentially get, or even our patients, which is why we're trying to take all the appropriate actions that we can to try to decrease the spread of this deadly virus. We delivered a letter with these ideas to the president of our hospital approximately 11 days ago, and we finally got a brief reply yesterday, but the hospital has not agreed to any of the ideas I just mentioned. With everything we were facing as frontline healthcare providers, the last thing we want to be worrying about is our union contract. While in the Presbyterian system, we represent a small pocket of unionized residents in an otherwise non-unionized workforce. And over the past few years, our hospital system has given large raises to our non-union counterparts and have unfortunately left us behind. Through our contract negotiations, we've been asking for pay parity for months. We believe that as members of the Brooklyn community, that we're providing care to our fellow Brooklynites, and we believe that we provide exceptional care, and the care we provide is on par with the care provided in Manhattan. NYP can show us that they value us equally to our Manhattan counterparts, but paying us equally, especially considering we're part of the same system now. We're so proud to be on the front lines of this healthcare crisis. We stand in solidarity with the residents at Sinai, Presbyterian, and honestly, all healthcare providers during this crisis. But again, it's been deeply disheartening that we're not being paid equitably, especially at a time like this. Unfortunately, the New York Presbyterian system has been dragging their feet on our contract negotiations since the fall, and now with COVID-19, they've used this as an excuse to delay our negotiations indefinitely. We've asked for a swift resolution because the last thing we want to be doing is worrying about our contract in addition to taking care of some of these critically ill patients. Most recently, the hospital said that they want us to keep working under an expired contract at least until the end of June of this year, meaning that we will go at least 8 months without the raises that we were due back in November 2019 when our contract expired. We were disappointed that the hospital has chosen to stall our negotiations right now, especially during this crisis. All of the residents and fellows have been extremely flexible, even nursing and attending providers as well, because we know that medicine is a team sport and we're all in this together as a community. In addition, sometimes we've been asked to work outside of our specialty or comfort zone to try to help with all the ongoing influx of patients that we've been dealing with. So in closing, we're just asking for pay parity and a settled contract so we can focus all of our attention on this worldwide crisis.
Thank you, Dr. Doherty. Now we will switch over and hear from a resident from Mount Sinai, Morningside and West, Dr. Jacob Feldman. Dr. Feldman.
Yes, thank you, Dr. Alvarez, and thank you, Councilmember Lander and Rosenthal for all of your support. As Dr. Alvarez said, my name is Dr. Jacob Feldman. I'm a current PGY2 resident in psychiatry at Mount Sinai, Morningside and West. Similar to Dr. J. Kumar and Dr. Doherty, I'm not a representative of the hospital. I'm only here to speak in my capacity as a resident physician and as a member of the SEIU bargaining committee. I will begin working on the inpatient medical floors this Thursday, but many of my colleagues have been working there for weeks, and I wanted to share some of our collective experiences and concerns. Things have been getting more dire every day. The number of COVID patients continues to increase, and our ICUs are full. For weeks, frontline healthcare workers have been afraid of contracting COVID-19, and while symptomatic residents have been told to stay home, they are worried they pass along the disease to their coworkers and their patients before becoming symptomatic. Residents that have remained asymptomatic continue to come to work without being tested, even those with high-risk exposures. Repeated requests for adequate testing have been denied with administration stating that the worried well will not be tested. This continued refusal greatly increases the risk of more residents getting sick and the spread of COVID within the hospital. There's continued discrepancy between what our administration is telling us and what we are seeing on the front lines. Just last week, Ken Davis, the CEO of Mount Sinai, told Governor Cuomo that we are not low on PPE. This is the same week we lost a beloved nurse manager to COVID-19. Frontline healthcare workers from China and Italy are donning gowns, hazmat suits, goggles, and N95 with surgical masks. Here on the front lines, our residents have not been provided anything close to this. My colleagues on the medical floors and emergency rooms have been given one gown for a day and asked to carry it from room to room. They have been given one N95 to use for a shift, sometimes even for several days. and N95 masks are being collected for cleaning and reuse. So lost amongst this dire situation is that Mount Sinai, Morningside, and West residents have been working under an expired contract since October, leaving us to confront the myriad challenges posed by COVID-19 pandemic while still struggling to afford basic living expenses. After months of bargaining and even a rally by SEIU members, the hospital continues to offer salaries that lag significantly behind other Manhattan training programs, even that at Mount Sinai main campus and Mount Sinai Beth Israel. In 2018, Mount Sinai sharply increased rental prices in hospital housing at Mount Sinai West, but they've yet to increase salaries accordingly. This has created an unsustainable situation for our SEIU members who face steep rent burdens in hospital-owned housing. The hospital claims that this rent increase was based on market rates, citing an appraisal comparing the previously affordable housing at 515 West 59th Street to luxury condos nearby. This building is assuredly not a luxury building. After presenting evidence of this at the bargaining table, Mount Sinai's only solution thus far has been to offer apartment sharing. It's worth noting that during this crisis, hospital leadership has reportedly been working out of Florida vacation homes, while the residents remain in the city, working on the front lines on a daily basis, only to return to these small apartments that we can barely afford. We need more than verbal assurances to the governor. We need pressure on Mount Sinai to settle a fair contract now, one that directly addresses the housing price increases and pay inequality so that our residents can continue to focus on patient care. Our other hospitals in the city have settled contracts during this time for this exact reason. We need honesty about the availability and the limitations of current PPE supplies and timely and adequate response from our hospitals to address these shortcomings. We implore not only Mount Sinai, but all hospitals, as well as the CDC, to recognize the unique nature of this virus and how easily it spreads amongst healthcare workers and their patients. We need leadership that prioritizes the safety of residents and builds protections based on scientific evidence, instead of on the availability of PPE or concerns about cost. These actions will not only address the health and safety of frontline medical providers, but also that of each and every patient we encounter. Thank you so much for your time, and I'll turn it back over to Dr. Alvarez.
Thank you so much, Dr. Feldman, and thank you to all of the resident speakers that we have on the call today, as well as those who are remaining anonymous, not only for the work that you do, but for standing up for your colleagues in the midst of everything that is happening. And to thank to the 2 council members that were here. That type of public support is so important for our frontline providers right now. So thank you so, so much. We're now going to hand things over to our Director of Public Affairs, Susan Naranjo, to open everything up for questions. Thank you, everybody.
Thank you, everyone. And now we would like to open it up for any questions for any member of the program. Are there any questions out there? Please introduce yourself first.
No, she's not there. Okay, thank you. So she's not on 11.
Go ahead. I think someone had unmuted themselves. Are there any questions for anyone on our program from the media?
I have one or two. I mean, I'm glad to defer to media first, but there's a couple of things that I'd glad to ask if there's not a media question yet.
Sure, go ahead, Councilmember.
Yeah, so I just want to ask a little more about the PPE situation, because it is one where I had reached out to Methodist, to try to find out what the situation is. I'm getting reports, as others are, of like, there's a case of N95s over here. And I will say that like Maimonides Hospital has been very forward saying, please get anything you can to us, and like admitting that they need them. But when I have reached out to NYP or to Methodist specifically, say, if I can get my hands on 400 N95s, do you need them? And what I've gotten back is, we're okay with the supplies that we have. So, I mean, I appreciate what Dr. Feldman said, but I think if you could just give us a little more understanding of kind of both what you're hearing and what you're getting and being expected to do, it can help us, in our push.
And can I just add to that, Brad? That's exactly, I was gonna just also point out this disconnect between what the heads of the hospitals are telling us and what you're saying. And Brad and I were just texting, we're gonna do a joint letter together and some other things in order to take this to the next level. But it doesn't have to be on this call, but sort of a list of what is the right amount of equipment that should be given to the frontline staff every day. In other words, you mentioned that you're required to wear the same gown for an entire shift, meaning that you're exposing non-COVID patients to COVID just by wearing that same gown. So a list of what it should be, I think would be incredibly helpful.
I think that is one of the problems actually that we're facing, is that they keep changing those regulations of what is appropriate PPE for the situation. And it's been changing on pretty much a daily basis for us, where, you know, like 2 weeks ago it was totally different. And now they're, you know, I think a week ago they gave us 1 surgical mask per person, and it was pretty much wear this indefinitely. Bring it home if you need to, wear it around your family members if you need to. And then, you know, the following week, then they said, now you're going to get a new mask every time you come in. So it's pretty unclear. And I think that that's kind of part of the confusion, the anxiety, and the fear of the residents, is that like we really don't know what our PPE situation is.
Can I take a stab at answering something too? Or if you want to.
No, keep going.
So my name's Sarah Especio. I'm one of the EM residents at Mount Sinai again. And just to give my own disclosure, you know, I am not speaking as a representative of the hospital, but a doctor speaking of my own experience. And I think to answer your question, there is some discrepancy between what the CDC guidelines are saying right now and what providers, anybody working in a situation, feels comfortable with. And, you know, just to make an evidence point about this, the CDC, to me, which is shocking, is saying that bandanas are acceptable in desperate situations, essentially. And there's actually a study, like a clinical study that was done using bandanas versus surgical masks, showing that bandanas have a significant risk of contracting disease versus surgical masks. So it's shocking to see a government organization that basically doesn't seem to be using evidence at this point, but is completely reacting to supply issues. So when the hospital is saying they have enough PPE, to me, it seems like they're going based off of the CDC guidelines, which say you could use a surgical mask, you could use a bandana. However, as an emergency room provider, we have been fighting for appropriate PPE, which we consider an N95, a face shield. And to be honest, I think most of us would feel comfortable in full-on bodysuits, as has been demonstrated in other countries. And we've been fighting for this every day for the past few weeks. So the hospital has been very reactionary. And I think what Mogana was saying as well is like, it changes for us every day. And I think that causes a lot of anxiety. So I can speak to my own experience, which is a few weeks ago, I was actually explicitly told to not wear a mask in the emergency room. And I wear a mask generally through flu season. A lot of physicians will, because the nature of the emergency room is that there's people in the hallway, there's people coughing, there's people sneezing, you know, and this is what we sign up for as doctors. I sign up for exposure. I know that's a risk. But it's the nature of the environment is that it's very likely to contract kind of respiratory diseases. So I generally wear a mask. I was told not to wear a mask. I made the decision to continue wearing my mask. When COVID started becoming more prevalent, a lot of us started wearing N95 masks as well. And part of the thought process behind this is that anything that's considered an aerosolizing procedure means that, you know, you're at high risk of kind of contracting these airborne particles, and these procedures are considered intubation. However, you could argue, and many people would argue, that coughing and sneezing is also an aerosolizing procedure, which again, when you don't have private rooms, when you don't have walled off rooms or negative pressure rooms, all these patients are in common areas conducting these aerosolizing procedures, and that would warrant an N95 mask for protection. So the hospitals reacted to each of these things, it feels like a little bit after the fact, you know, but I'm sorry, I feel like I went on for a little bit, but I think that there's a big discrepancy again between what we feel safe having and what the CDC is having. So I remember last week when we saw, like, I watched Cuomo on that briefing be like, oh, we talked to Ken Davis and they said we have appropriate PPE. And coming from a frontline provider that goes to shift and has to be like, can I have a mask today? And you're told no. Like, we had providers that same week going in asking for N95 masks in the emergency department and explicitly being told, no, you do not get an N95 mask. There's just a huge discrepancy going on.
And I think I'll add to that a little bit. When you do get access to that N95 mask, it's like the holy grail. You don't lose it. You try to use it as much as you can. We're trying to stretch them with surgical masks. And you have to assume that that could be the only one you might get for a while. Just because in my experience, it hasn't been clear. I know that recently my personal department was able to get some and handed another one out. But it's just been a little unclear of when the next one's coming. So most of us are trying to hold on to ours, for dear life as much as we can and keep it clean.
And a big point of this too, that only adds another layer of it, is that one, we're witnessing that our hospitals are underprepared. But two, even though hospitals know how many residents they have, they are frequently undercounted when it comes to buying supplies. And that's because residents are all throughout the hospital. So for example, you will know on a floor how many nurses you have, how many med techs you have, how many social workers, caseworkers, so on and so forth. But the physicians rotate on all different floors. And so those residents are not being incorporated or counted when it comes to getting enough protective gear, and are usually the ones that are on the floor left without PPE when it comes down to it.
So I'm just gonna jump in here. I wanna read some answers from emergency medicine and an internal medicine residents who are on here. So this is from the internal medicine resident. Ken Davis did tell Governor Cuomo last week that we had all the PPE we needed. However, how they define PPE is very important. As mentioned, Mount Sinai has de-escalated the PPE policies that we think we need based on the CDC guidelines, who have also decreased their recommendations from airborne to droplet. Mount Sinai believes that all we need is surgical masks, when, as mentioned by my colleagues here, we all strongly believe that we need N95 masks at minimum at all times. The OSHA guidelines are different than the CDC, and I think those would be important to highlight. So the question of if we do have N95 masks, yes, they have now finally been available. However, it's never been okay to reuse N95 masks for an entire day or several days. Gowns, gloves, and masks are all designed to be used for one-time use only. Face shields lose their integrity when they are washed down with bleach wipes. And in fact, Sinai initially told us that we did not need masks at all. And until we were able to get a petition signed by 200 residents saying we did not feel comfortable with this, that's actually when they finally agreed to give us surgical masks. And here's more on the floor. There's a contention between nurses and residents because nurses did not want to dispense PPE to residents. And in fact, multiple coworkers had to start GoFundMe pages in order to raise money to buy supplies for residents. This has been ongoing for the last few weeks. And I can tell you from personal experience that I have connected Mount Sinai, as have multiple colleagues, with alternative sources of FDA approved N95 masks, face shields, etc. that, while they would need to be paid, they're not donated, they would be charged essentially as close to cost as possible. And not only has Mount Sinai not ordered from any of these sources, they haven't even reached out to these sources yet. And this is something that I know I can speak to personally as of today. My source has not even heard from them. So I think that's important to mention. Then, sorry to keep going here, but this is from the emergency medicine resident. An ideal situation would require a different gown and mask for every single patient. Mount Sinai West will publicly say that they have never told us to reuse gowns, but for weeks, providers in the ED were using the same gown all day and contaminating workstations and other non-COVID patients for what the hospital supplied us with. And for anybody who's interested, my colleague, the internal medicine colleague, shared the OSHA guidelines in the chat as well.
One thing that I really just think is worth flagging here, you guys as residents, I think are a lot younger than me, so maybe you don't have quite the long sweep of history in New York City, but I really think that the CDC guidelines that have weakened protections are going to wind up looking like those folks who said that it was fine for workers to be on the pile at the World Trade Center in the aftermath of 9/11, and then, you know, over years found that they had sentenced people to death. So, you know, the CDC or no CDC, like, I think you guys obviously have a good sense of what is needed to keep you safe.
I have a question, if that's okay. My name is Maya. I'm a journalist with ProPublica. And yeah, for the council members as well, what have you all heard from hospitals when you have tried to reach out and ask if they do need equipment, and what kind of ability do you have to connect these hospitals with equipment?
I mean, this is pretty random, but literally yesterday, a constituent reached out to me by email because a store in my district, Save on Fifth, I don't know, anyone that's ever lived in Park Slope knows Save on Fifth. It's like the legendary of the high-end 99-cent stores, has N95s, and that, you know, this person was concerned that they were price gouging for them. But anyway, I called, you know, Save on Fifth, and said, let's get those in the hands of healthcare workers. And so he said, my suppliers have jacked up the prices a lot, but I'll give them to you at the price that my suppliers are charging to me. And, you know, it's a few hundred, it's not tens of thousands, but so I immediately reached out to NYP and said, you know, Methodist is the hospital closest to Save on Fifth and closest to my house. Do you need them there? And I was told that they don't, that they're in an adequate situation with PPE. I then reached out to Maimonides because Maimonides is, you know, it's not quite, it's right outside my district, but I do a lot of work with them. And they say, yes, please. You know, we could use them. And so I'm gonna find a way, I think, for some of the Methodist interns and residents on this call to get a few, but you know, that was the difference between the two. And obviously Maimonides is, you know, though part of the Northwell network, it's different than Methodist being fully part of NYP, but that was my recent experience.
I was on the phone this morning with Mount Sinai on the east side, talking about the tent that they're putting up. And as part of the call, they definitely said they have plenty of PPE, and should they need any more, they can simply ask the governor, and equipment will be sent to them from the warehouse. So they have absolutely no concerns about the supplies they have.
I do want to say, and I think Dr. Feldman had touched on it too, there are residents around the country starting GoFundMe pages specifically for this issue, and it's been crazy because we've been, as part of CIR, dealing with the hospitals are not happy about this because it doesn't look good optically, and we're like, these residents and these employees have every right to do this and to do this to protect themselves. And so it's something that, you know, is not getting the type of response from the hospitals. It is more that the hospitals feel as though their public image is much more important than their actual workers that are on the front lines. And instead of this being a collaborative effort where we can work with our hospital systems and tell them what's going on, and as physicians tell them what changes need to be done, they instead are either shutting us out, threatening us, or just trying to keep our residents quiet and employees contained as they're trying to deal with this COVID crisis. And so that really is the biggest part of this, is that the hospitals don't even want to hear from us for help because they are so concerned about the public image.
Yeah, just in that.
Like some sort of letter from the hospital indicating that you could send to the press?
Susan, do you know if we do have the optics on that? Or Councilwoman Rosenthal, do you mind repeating your question?
Oh, yeah, sorry. whether or not what you just said is so troubling. And someone had mentioned earlier about you're very early on collecting some good ideas, and then you're being told recently, no, we're not going to implement any of these. Do you have that in writing, and could you share that with the press?
So some of these conversations have come down to one-on-ones with some of the residents, and that's how we're getting most of those reports. And in meetings kind of like this, where we're having, when we do get people together, and what we're hearing is it's not good optics for the hospital. And of course, residents push back and say it's not good optics to have us all out because you didn't give us the right PPE. But essentially, they're still asking folks to take down their Twitter messages, anything they post on social media, and it has gone as far as asking folks to take down their GoFundMe pages for PPE. And so this is not just for New York specifically, this has happened across our different hospitals nationwide. But nothing in writing so far from what we have seen. It's all been on one-on-one conversations.
And I just want to jump in and read another comment by one of the emergency medicine residents at Mount Sinai, Morningside and West. So they say, in our experience, the hospital will never say they are short on supplies for appearances, but the reality is that they are very short. They are now collecting N95 masks and using untested methods for cleaning and reuse that could possibly result in more infections for healthcare workers. The evidence for that is still undetermined, but it's certainly not proven, as they mentioned. Councilman Lander's comparison to the workers on the pile is how many of us in the ED feel currently. I and my colleagues would not have reached out to our entire social networks to acquire PPE if we felt safe.
Of course.
I think that's another thing that is just shocking to all of us, to be honest, is the fact is medicine is based, the practice of medicine is evidence-based usually. We don't do things based on hearsay or, and I think the question is we do not understand necessarily how this virus is transmitted yet, right? There's debate, there's questions. There's a New England Journal article that says that it can live in the air for 3 hours, right? Which is where a lot of this is stemming from, evidence. And why would you be less cautious versus more cautious? Like, that's the question a lot of us have, is like, why would you put us at risk with unsafe equipment? We're all dedicated to medicine, dedicated to taking care of our patients, but how can you ask us to do that without, in New York City, at Mount Sinai, at New York Presbyterian, at these huge institutions, right? Where we, it doesn't seem like money should be the issue or obtaining these supplies should be the issue. It's that it feels like they're just not giving it to us and they make us fight for every step. I can tell you, echoing what somebody said before, a lot of this stuff is not in writing, and I appealed. I wrote an email saying, I have a 7-month-old child. I have asthma. I work in the emergency department. I don't feel safe. And the response I got was that a surgical mask is sufficient for you. And again, this is just, we're genuinely, like one of my colleagues mentioned, I wouldn't be reaching out to friends and family begging them to help me get masks if I felt safe. And why would the hospital not want to protect us?
Of course. Yeah.
I have a quick question. I think it's important for the general public to be aware of some of the consequences of this that are already happening. And so I'm wondering if any of you can speak to anybody in your units, on your floors, having already contracted the virus and being sick and taken out of work.
So I can speak to that. I mean, I know we have an internal medicine resident as well who will likely add comments, but I know we have multiple residents who have tested positive for COVID, who have gotten sick and have been having to stay home. And because of this, combined obviously with the increase in the number of patients being seen with either likely or confirmed COVID infections, I can speak to us as the psychiatry department was asked for volunteers to redeploy to internal medicine, and that has been done. And that is what, as I mentioned at the beginning of my talk, that I'll be starting there on Thursday. And I'm happy to do so. And it's as my colleagues here said, like, this is what we signed up for and this is what we expect. You know, we don't expect anything less than to be put on the front lines, but all we're asking for is adequate protection, and protection that is based on evidence and not based on, you know, perceived supply issues or costs or anything else. You know, that's all we're asking for at this point. So yeah, that's specifically here. So from an emergency medicine resident, they have at least 5 residents who have been COVID positive and multiple attendings who have also tested positive.
And around the country too, is this has been an issue, and I think our colleagues in New York can speak to it. It is very difficult for resident physicians to even get the testing done if they suspect that they are having symptoms or had a very real exposure that they are very worried about. You know, a lot of the hospitals are not testing their own physicians or employees and telling them instead, if you're concerned, go call your doctor and go get the test done. And, you know, I would love for some of our colleagues to speak to that, because that too is a big part of that issue, that, you know, it's almost this ignorance is bliss, that this doctor can keep working because we don't know that they have COVID and it's not confirmed. So let's let them keep working. So if anybody wants to take that.
I myself I'm on quarantine right now. I developed symptoms last weekend, and I was definitely exposed at work. And my experience was that when I reached out to my workforce health system, I was told that I should not get tested at this point, because they're saying that everybody is presumed positive. If you're symptomatic, they said just stay home for 7 days. And if you're asymptomatic, even if you're for the last 72 hours of that, then you can return to work. But at this point, they're not testing any of the residents, as far as I know, anymore.
I'm just going to read off the comment from an internal medicine resident here. So they're saying, I had extreme fatigue for a week, followed by dry cough at night. I told my leaders and they were not concerned. A few days later after that, I spiked a fever, had shortness of breath and chest pain, and ended up in the emergency room. I was tested for COVID. I self-quarantined for 9 days. It took 10 days to get my test results, which were positive. Prior to being taken off service, I likely infected multiple coworkers and patients. Residents in internal medicine have been continuously concerned that they are asymptomatic carriers, and we have continued to be denied testing. We are likely spreading the disease to each other and our patients. The refusal to test residents is leading to the spread of the disease. However, they do not want to test us because they don't have records of how many of us are sick. Currently, they will say only 4 of us are infected because only 4 of us were tested and were positive. Here's more from the emergency medicine resident. Not only is it dangerous to other providers and patients to not know if providers are COVID positive, if there is a long-term health consequences, the hospital would be able to avoid a paper trail that showed that employment in the hospital resulted in those health consequences. And again, those are comments from an internal medicine resident and an emergency medicine resident.
And also at our facility in Brooklyn at Methodist, you know, I've also heard personally, you know, many attendings and also residents and fellows have also either tested positive or had symptoms enough that they were asked to quarantine. So it's hard to give an estimate exactly what percentage of the resident workforce seems to either have had symptoms or tested positive, but, you know, it is considerably high. So in addition, you know, kind of like what we were discussing earlier, I think it would be important to note that also other essential providers such as, you know, the Whole Foods, supermarket, those types of folks are also asking for similar protections that we are asking, as they also deal with people just in the general public. And we're healthcare providers, and typically, you know, we're seeing these people as they're much, much sicker as opposed to just in the community. So, you know, that's why we're trying to seek as much protection as we can get. You know, I can speak for myself personally. I've heard a lot of ambulances just in the background, you know, from my apartment, just showing how busy. You know, I hardly ever hear that, but, you know, everything's been very busy. I know some of my colleagues have said that, you know, there's multiple rapid responses in the hospital. You know, these patients are unfortunately very sick. So, you know, that's what we're dealing with, and that's why we want as much protection as we can.
And actually, Dr. Doherty, you brought up one really, really good point. You know, our residents are at such a capacity right now that they are seeing more patients than they have ever seen before. Usually census or the number of patients a resident team will have will be, you know, 14 up to 16, sometimes even 20 patients. Right now, I was on the phone last night with a colleague of mine in a hospital in Brooklyn, and she has on her service over 50 patients, got 15 admissions in 1 hour and 3 codes. And that, you know, that was at 8 p.m. Like that is like what our new reality is. And we're the first line in my conversations with residents across the country. I hate to say it, but this is like that ground zero, just like you were describing, Councilmember Lander, that the way that we are hit in New York is so grave right now, and the rest of the country needs to take this as an example and to really start setting in line, you know, real requirements, making sure that their employees are being listened to and they are also protected, because this is not something that is going to go away in a matter of weeks. And we need to make sure that our frontline providers are able to stay safe and healthy so we can continue fighting this not only for weeks, but forever, how long this is going to be here. And I think that, you know, that is so direly important, and we appreciate, you know, all of you in helping with this. And echoing that aspect of PPE, imagine having to now reuse your protective gear basically on 50 some odd patients. Like that's the type of capacity that we're looking on. And so, you know, we appreciate all of your support, and any way that we can continue to amplify our resident voices as frontline providers is so appreciated. So, you know, just thank you so much.
Thank you everyone for participating today. If anyone has any further questions for our residents, you can reach out to me. My contact info is on the media advisory. And we also have Mount Sinai residents who are available to speak to the media as well, anonymously. So please reach out to me if you have any further questions. Thank you all so much for participating, to our members who have taken the time off way to do this today, and of course especially to Councilmember Lander and Councilmember Rosenthal. Thank you all so much.
Thank you.
Thank you, everybody.